Welcome to the Southern Africa Regional Students and Youth Conference on Sexual and Reproductive Health.
And we hope that we'll be able to gather young people from the SADC region. And I'm told that you are here 8 countries represented, mostly from the universities.
Zimbabwe, Zambia, Malawi, Mozambique, South Africa, Botswana, Lesotho, Namibia, and Swaziland.
There is need to ensure that sexual and reproductive health issues affecting young people remain a key priority.
Government, through the Ministry of Health and Child Care, absolutely supports the initiatives that are being taken by young people to address the issues of sexual and reproductive health rights.
Therefore, there is need for us to prioritize young people in all our interventions.
What I see today is young people drinking alcohol, buying the most expensive whiskey. And if we continue in that projection, if we continue in that direction, who is going to find solutions for the young person who hasn't had the opportunity to sit in this room today?
zvakandipedza vana taiseva inanga I believe kuti tese munhu wese ari panapa ane power to overcome child marriage and to help us as women, as young women, because mune vakagara mukati umu vari kushungurudzika.
And most of the times when you talk about child marriage, it's statistics that we hear in the newspapers and whatnot. But these are lives of real people that we are seeing here today, the lives of Margaret and the other girls that are in front of us.
The problem is that we are suffering in silence. We are seeing child marriages take place, but we are keeping quiet. And also, I think we need education, conscientization at every level. And also, I think we need to have education of what our Constitution says.
I am one person who believes very much in the role that men can play in ending child marriage and in ending violence against women.
Use this event to find ways to get more young women into tertiary institutions, to keep them safe in their schools, to scale up cost-effective ways to screen and treat SRHR issues in safe and convenient settings for students. Use this event to find ways to prepare institutions to make comprehensive sexuality and sexual education a reality in schools, at home, and possibly even in workspaces for young adults.
So you're looking at those two groups and you're looking at an increase in terms of the HIV prevalence rate. Big questions are being asked: what's happening with this kind of young people? Are we giving them the services? If we are they using them correctly? Those are the questions to be answered, and I'm glad in this room we have students, so I'm sure some of them will testify to the fact that either we're using or we're not using them, or perhaps, like the madam was saying, they're not trending enough.
When you've been sitting in a space for a while, there's always the habit of repeating what has been said already. One of the problems with that is sometimes when you hear the same things over and over again, the fact that we still have our jobs means that we are still re-engineering a crisis, which means that there's something that we are not doing properly that keeps us in this place where we have to push for change. Our countries are all looking to us to change our economies. And what that means is, as we finish school, we must have access to jobs. If we don't have access to jobs, we need to create jobs. And by so doing, we change the entire dynamic of our health infrastructure by creating money that is available to invest in health. We are the people with the power. And even though we know that there are others who have greater power than us, we at least know that we also have given them that power, so we have more power than them at the end of the day. And appreciating that gives us the power that we deserve.